Previously, I talked about some of the structural flaws in the healthcare system and how improving communication between physicians and patients might improve outcomes for everybody. In talking to Z, she had a lot to say to reinforce that concept. What doctors tend to forget, and what I myself forget from time to time, is the vast difference between the language of medicine and plain English. There is a need for precise language in medicine so that doctors can effectively communicate with each other. Arthritis isn't a very descriptive term and can mean any number of diseases. Ankylosing spondylitis is a very specific disease process causing a type of arthritis that affects treatment and approach in medicine, but the average layman doesn't really care about. Medical education often fails to teach physicians how to effectively translate medical terms into plain English that the average American adult can understand. By some estimates, a medical student may learn around 15,000 new words throughout their first 4 years in a standard curriculum. Our grasp of human health is taking from this enigmatic concept to one that can be printed out into charts with numbers to quantify well-being. Erythrocytes, leukocytes, eosinophils, magnesium, potassium, prothrombin, aspartate aminotransferases, and their accompanying reference ranges that mean absolutely nothing to the masses, but can paint a vivid picture of any number of diseases to those with the proper medical training. Yet with all this newfound understanding seems to come with the loss of viewing patients as real people, with lives and loved ones behind those numbers. As he reflected on an early terrifying interaction with medicine, quote, I was seeing a doctor for a physical, and I kept telling my doctor I was feeling really horrible, and he said, well, you look fine, everything else looks great, you can go home. But over a whole year, I kept going back to my doctor saying, I'm not feeling good at all, I'm feeling really, really bad. Eventually, when they found out what was wrong with me, I had hyperthyroid. I had a large nodule about the size of a grapefruit on my throat. When the doctor finally discovered it, he said, well, I've got to run out. Stay right there. I'm going to go get some of my colleagues. He ran, and he got about 7 other doctors. They all ran in, and at this point, I'm freaking out. And he says, well, we found out what's wrong with you. And they basically gave me the death sentence right there in the office. They said because it was so far along, it was not operable. I've been seeing my doctor for a whole year. I kept telling him repeatedly I was feeling horrible, and he kept saying I was fine, go home. Now he says, there's really not too much we can do for you. So I said, can I have a second opinion? They didn't give me any solutions. It was just kind of a death sentence. So I left the office, and I was so... When you tell somebody that you're going to die, I was 18 years old. I was just totally... I didn't know what to do. End quote. Z later explained to me the difficulty of attempting to find a doctor that she could trust on her own. She talked about the painful lack of follow-up by her original doctor. Even after telling her her condition was likely fatal, no one called her to see if she was okay. No one offered to help her find someone else. She told me how the isolation of trying to navigate the medical system alone as a teenager with her life hanging in the balance added to the trauma of the experience. If you've never known the frustration of trying to be taken seriously at the doctor's office, then I'm glad for you. One would like to hope that this is rare, but in my experience, that's not really the case. I may be biased in this assessment, as it once took 4 doctors 11 days to diagnose me with an asthma attack. Call me bitter, but I think a lot of healthcare providers can fall into a trap of thinking things are nothing because they look enough like something else, and it's just easier not to do their due diligence. And granted, when you take the grand total of young adults that feel unwell, 99 out of 100 will be something minor. When I was in my internal medicine rotation, I met every diagnostic criteria for clinical depression, which went away when I switched rotations. We shouldn't overlook the fact that sometimes it is normal to feel bad. If you're constantly stressed, have a difficult home environment, or struggling in school, or recently experienced the loss of a loved one, yeah, I'd be more concerned about you if you weren't a little unsettled. It should never be overlooked, however, that a psychosomatic cause of symptoms is a diagnosis of exclusion, meaning that while it may be possible that you feel bad because bad things are happening in your life that begin to translate into physical symptoms, in medicine, other causes of your symptoms need to be ruled out first. Why? Because of the exact thing that happened to Z. A thyroid level should have been among the first tests to be checked when she came in with a vague complaint like not feeling well. And maybe it was. Maybe it was on the line between normal and abnormal. Maybe it was high and never followed up on. And maybe it truly was never looked at. And the doctor was so convinced that this woman was complaining about nothing that he didn't even check basic labs. We can't know the answers to details like this. We only know what should have been done and the final result. Quote, I found a different doctor. He went through all the tests and he decided to do radiation treatment on me. He said, you're going to be radioactive. I was so terrified. I had to go in and I drank clear radiation. The whole thing was terrifying, and it was kind of funny and not funny because the nurse said, "Don't choke." And I'm thinking, oh my God, why would she tell me something like that? Don't choke. And she left me in the room. I had this big iron thing on me. I had to sit there and drink this stuff and don't choke. While a sense of humor can go a long way in making a difficult job manageable, it's probably even more important to recognize that there is a time and place for everything. Like I mentioned in the last video, the things that medical providers see on a regular basis range from the devastating and tragic to utter miraculous and everything in between. It can be easy to forget how much each trip to the hospital is impacting the patient. A parent might blow every stop sign on the way to bring in their child feverish and screaming to the ER only to be the surgeon's fourth appendix case that day. Among the worst days of the child and mother's lives is regarded as just another day at the office for the people who work in the hospital. There is an aspect of preserving sanity to this. Emotional fatigue can be devastating to career and patients alike, and at a certain point you have to find the humor and the unfunny and the bright side of the darkest situations just to be able to go to work every day and do your job. This doesn't change the fact that for patients and their families this is not the everyday. And what will stick in their mind more than anything, regardless of the result, is the fact that healthcare workers seem like they didn't care. Yet, I've also had the experience of laughing about a situation helping. Sometimes humor can diffuse tension and help a person get through a rough day. So when is it appropriate? I mean, this isn't even a problem that just healthcare workers have to solve. Raise your hand if you have that relative that makes ill-timed remarks at a funeral or holiday dinner. Raise your hand if it's ever been you. Z concluded, quote, "The thing I would say when you tell people things is to be more tactful about it. Don't be so harsh," end quote. This is probably applicable to most people, but a healthcare worker's career is made out of other people's bad days, and tact is an art form that will never go amiss in hospitals. Z also described another incident when she was given a medication that she later developed a severe reaction to. She told me when she looked up the medication later, it warned that it was higher risk in African Americans. When talking to physicians, they stated that this is true but also needs to be taken in context. The medication prescribed is first-line blood pressure medication for everyone. Though it seems to have a slightly worse side effect profile in African Americans, it is still a highly effective medication. Side effects can happen in anybody with anything, and there isn't a way of knowing it until after they develop. Even among different medications in the same class or even different formulations of the same medication, people will react differently. Though I would say it's not too much to ask to have some disclosure of this information when you're put on a new medication. This is always a point where the patient should advocate for themselves. It is never unreasonable to ask about common side effects or develop a plan before leaving to get started on something else if the side effects are intolerable. It is also reasonable to ask why you need to be started on the drug at all. Is there something you would be willing to change in your lifestyle that could help? Are there other medications that have a better side effect profile? Maybe they are more expensive or they're not as well studied but would work better for you in this situation. Communication is vital to the practice of medicine. The healthcare workers must use it to effectively build trust and put a foreign language into plain English. It is no small task, but no one chose healthcare as a career because it was easy. Still, there is a patient responsibility here. Your health is in your hands, and if you cannot take the medication as prescribed, then you cannot expect the doctor to know this until you tell them. Doctors often have 20 minutes or less to make a call as what is going to work best for you. If you aren't being heard, then it is your job to speak up. This may mean repeating yourself or seeing another provider if necessary. It may feel intimidating to contradict a doctor or embarrassing to say that you don't think you can do something, but your life is on the line, and doctors are just people too.